Welcome to Menopause the Positive Way, the podcast that inclusively supports Women Plus moving through their menopause journey with greater ease, control, and an empowered mindset. You can subscribe to this series wherever you get your podcasts. Brought to you by Positive Health, making life easier and helping you make a change for the better. Hello, and thank you for joining us on Menopause the Positive Way podcast. My name is Courtney Pesic, and today I'm your podcast host. Today we are speaking with Dr. Ronke Komolafe, and our topic today will be on integrated mental and physical health during menopause. So welcome to the podcast, Dr. Komolafe.
Thank you, Courtney. Thank you for having me.
Yeah, I'm very excited to have you on this podcast. We had a few minutes, obviously, to catch up and talk about the topics that we're talking today. And I was absolutely enamored with your background. Would you mind giving us a little history on your background and what you have been accomplishing?
Thank you, Courtney. Thank you very much. As you know, my expertise is in mental, physical, and behavioral health and social health. My background really is integrating mental, physical, and social health. I'm the founder of Advancing Integrated Health, a consulting company that helps healthcare technology providers and policymakers integrate healthcare, integrated behavioral, and social health programs. I also am the founder of Integrated Health Magazine, where I focus on bringing thought leaders to share their views about integrated health. I'm also the mental health chair for Forbes Business Council and an adjunct professor at Morehouse School of Medicine.
That is fascinating. What got you into these fields?
So, as a kid, I always knew I wanted to be a psychologist. I thought I wanted to be a psychologist. I had talked about this. I knew I always wanted to get my doctoral degree since I was 4 years old. So I just kept going for it. And when I got to college, I started out as a sociology major and then transitioned when I came to America to a psych major, which was my dream.
Mm-hmm.
And I believed I was going to become a clinical psychologist. And after college, I started working in a mental health program before going to grad school. And during that period, I realized I don't like hearing people's problems.
Sure.
And being a psychologist, you have to sit down and hear people's problems and help them identify solutions. I would rather people talk about their problems and come with solutions upfront, right? And be more open minded immediately. But in psychology and mental health, you have to be slow and meet the patient where they are. So I decided I wanted something that brings solutions to the providers as opposed to being with the patients figuring out solutions. So I decided to get my MBA, and then from there I went ahead and got my doctoral degree in mental, physical, and social health. However, while I was doing this, I worked at Arizona Medicaid because I really wanted to understand how do you bring solutions on a systemic level. Medicaid systems, mental health systems, Medicaid systems from a technology perspective, and working with Arizona Medicaid really helped me identify this. And I transitioned from there to go work at a health plan where I was able to identify even much more how you can work with providers from a systemic level and a payer perspective. From there, I transitioned to healthcare technology, which really encompasses all things healthcare. I worked with Medicaid, Medicare, work with providers, work with everyone to be able to ensure the technology meets the providers where they are, which allow the providers to meet the patients where the patients are.
Well, gosh, and I bet you were on kind of the forefront of all that with technology, the way it's ramping up and showing up in our society. So seeing a lot of those issues and being able to talk with the providers and understanding so many different aspects of the medical world, that's a lot of information and a lot of execution and empowerment too, I would think.
It's really exciting. It keeps me on my toes. So when I talk about mental, physical, and integrated health, I always talk about how do we look at this from a provider, patients, technology, policymaker perspective so we can save costs and improve outcomes. Because when we really bring in all those perspectives, we can really help patients and providers achieve outcomes.
That's wonderful work. That's wonderful work. And so, as we switch to our topic within menopause, how do we see this? How do we have this comprehensive overview on the whole person health regarding menopause in this time frame?
That's a very good question. Really great question. You know, every diagnosis or healthcare aspect out there has a mental health component in the background and a social health component. So, looking at menopause, we know there are three stages of menopause, right? We have the perimenopause, we have menopause, and postmenopause. Looking at menopause itself, when you start from the peri to the menopause, you start to see these symptoms come up, such as night sweats, anxiety, depression, body changes, more sweats, sleeplessness. When you look at some of these symptoms I just mentioned, they look very closely like somebody who has a mental health condition, like anxiety or depression, or in some cases, even bipolar, right? So, usually, when we see this type of things in women who are going through menopause, it is important to empower these women to help them understand the difference between what looks like a mental health symptoms and what looks like a physical health symptoms. And sometimes they cross over. How do they talk to their providers who can help them identify this? So I can go ahead and break it down even more with some
Yes,
examples.
please. Yes.
Absolutely. Thank you. So, talking about having mood changes, right? Which in mental health, we would typically say mood disorders. Mood disorders is when a person has a combination of anxiety and depression. And these conditions are the most common conditions you see in individuals who are experiencing menopause. Anxiety could be racing. You may be having racing thoughts. You may be unable to calm down and be unnecessarily worked up. Irritability. You may become unnecessarily agitated. Sleepless nights causes that. Anxiety causes that. Insomnia, sorry, causes that. Now, when you look at somebody who's having a mood change, a hormonal change, they typically have sleepless nights, right? Racing thoughts, mood disorder due to the changes in estrogen that they typically experience. So, a lot of times, as individuals, when you're going through this, the best thing is to identify what you're going through. At least try your best to articulate it. Also, try to look at the time of the day this is happening to you, right? If it's happening when you're not going through any stress, maybe you're watching a movie on Netflix and all of a sudden you're having racing thoughts when it's actually a comedy, that tells you something is really wrong. When you document times when it's happening, then you can start identifying the patterns and actually ask yourself, was I in a stressful situation when this happened? Am I going through any type of stress in my life? And try your best to see a specialist. See your female's women's health specialist, your OBGYNs, your gynecologist, depending on what's going on in your life. If you're pregnant late stage, pregnant in your mid or late 40s or 50s, please see a specialist, not just in the primary care doctor, because when you see the specialist, they really do know what to look for. They know the right assessments to treat you for and walk you through the journey, right? It's always good to have a doctor consistently who is walking through this journey with you to help you identify this, but document this yourself. So the anxiety, you can take some steps to calm yourselves down, which is you can meditate. We talk about meditating all the time. Not everybody can meditate, right?
Right.
I personally am not a person who can meditate, like, sit down, meditate. I have to lie down or be reading a book to get myself in that mood, but I can never sit and meditate. I have to lay down and meditate
Sure.
or go on a walking meditation, right? But the typical meditation might not work for you. So identify ways you can meditate or you can write down, talk to people close to you about what you're going through, do some research on your own. Don't diagnose yourself using TikTok or Google.
Right.
do some
Right.
re- do some research on your own, and then talk to a provider to help you. They can then help you identify, is this a mental health issue, or is this a physical health issue, or is it a combination of both? And then they can put you on medication if that's required or guide you on the right path to take.
let's start bringing in the physical side effects of some of these things too, as we can touch on the physical stuff and then pull back in the whole health um, discussion about it. So, what are some of the physical aspects that you might feel or be going through?
It really different. It's different for each individual, right? So knowing your body is the most important thing, right? What changes are you going through? One of the first changes people see is something is not right, right? Some people notice they are necessarily angry, or they're not their usual self. They not it's not maybe that's not the right word to use. Their tone of voice and how they show up is not what they are used to or what those around them are used to. So you see the bodily changes of dryness in your private area during sexual intercourse. You do get dry more. People end up
Mm-hmm.
having more UTIs than they're typically used to. People have a lot of insomnia, tiredness, brain fog. And this is where I would like to pause for a minute. And this brain fog, it affects a lot of things. Some people feel like they cannot handle stress the way they used to. They are not clear with their thoughts and communication the way they used to. They're not able to understand critical thinking the way they used to, or express themselves the way they used to. I always like to give an example of an individual I know who wanted iced tea. And instead of asking for iced tea, she asked for, I would like tea with lots of ice, hot tea with lots of
Mm.
ice in it and lots of sugar. And it took the person she was talking to, the person she was talking to looked at her and said, You mean you want iced tea? And she's like, No, I want really hot tea with lots of ice and sugar.
I send it.
And you have to understand she was going through menopause, and that was how she could express herself, and that's really what she meant. And of course, she got iced tea, and she thought it was hot tea with ice.
Right, right.
So
Hit
that
the spot.
example, it hit the
Yeah.
spot, right? That example is quite an interesting example, because that's the way her brain could express what she was trying to say, right? And this is a high functioning senior executive going through this and expressing herself this way. But it was just a moment, right? About 10 minutes later, she went back to her normal self. Right. And when we told her what happened, she just laughed it up and she's like, Oh, that's just me. I'm just getting old. So it's always good to have a sense of humor and for those around you to understand what you're going through. So the brain fog is a big one where you just see your brain working differently. Or in some cases, it becomes a fast paced, high functioning where people around you cannot keep up. It almost looks like you have ADHD, right?
Mm-hmm.
But that's not the case. You may appear more impatient. That's not the case. You're just going through these hormonal changes. Again, let those around you know so they can help identify what's going on. In some cases, it might take an external person to ask you, Are you okay? This is what I've noticed recently. And it doesn't mean there's anything wrong with it. You're just going through physical changes of menopause, which is showing up as brain fog. Or in some cases, it might show up as a mood disorder. That's when you have the anxiety and depression associated with it.
Yeah, and I feel like in my journey, I've kind of hit all of those stops, if you will, or the questions to my doctor or PCP when I was going through things. And it was step one and then step two and then step three until finally we were like, oh, we're in perimenopause. But there was all different kind of life events that were also adding to what it could have been attributed to, right? And as we've talked about on the podcast before, like there is no outside litmus meter or anything like that that's saying, oh gosh, here we are now, right? So it is really that communication or the like you said, brain fog. And I can remember feeling that. And it was a little bit prior to COVID at the time. And so, where I think maybe a lot of conversation around brain fog became a little bit more prevalent, that it wasn't just something that was not made up per se, but that it really truly felt that way. But you didn't know really what that meant because you're foggy, right? Like, that you didn't quite feel right, but
Okay.
you do feel right, but you don't, but you do. And it is a foggy feeling, right? And then, as you had said, really taking inventory of how you're feeling. And that was such a great example of while you're watching Netflix, are you upset or is things racing while you're watching a comedy or a cooking show or something like that, where um, things can really come into play. But like, what happens with hot flashes, and what happens, when you start to feel those? That typically that was, I think, one of our main indicators. From what we knew growing up as young women, maybe in our 20s and 30s, it was like, oh, once you hit a hot flash, then you're in
Menopause.
menopause, right? There was not really even a conversation around perimenopause. There was just a hot flash, then connected to menopause. So, how do we bring in the conversations around hot flashes, and what are they? They can be so much more impactful than what's really happening, and especially around us in our social circle. Let's touch on that a little bit. What
Yeah.
light can you shed on that?
I went to a ballet recently, and one of my friends all of a sudden looked at, she's like, "Oh, it's really hot in here." And I'm like, "No." She's like, "No, it's really hot." And I'm like, "How long have you been feeling this?" She's like, "About, 2, 3 minutes, and it's just getting worse." I'm like, "Sweetheart, you're in perimenopause. I've been watching you
Hmm.
all day." And the truth about this is, somebody has to say it, because if somebody doesn't bring it up, you're just going to think it's really hot and everybody's hot while nobody else around you is hot. That is one example for somebody. Another thing you might notice is increase in your odor, especially your armpits, or
Hmm.
if you have extra layers of space beneath your breast, you might notice some more sweats and a different type of scent that you're not used to, right? I typically don't sweat, right? But I notice I
Hmm.
sweat now. Like, I have not sweat. I barely sweat when I go to the gym. But sometimes I notice I sweat more than I've done in the past. And to me, that means something is not okay. Something in my hormones needs to be checked out, right? So I think being able to identify these different changes as you start hitting your late 30s, from 38, you do want to start looking at this. And it affects your identity, right? Nobody wants to look and say, why am I the only one who's hot in the room at the age of 39, right?
Hmm.
We don't want to ask ourselves that question. Or at the age of 41, you don't want to think about menopause at that age. And I was recently talking to one of my friends who had to take time off work. And, she was just not getting things done, which is not like this individual. She's a high functioning individual who always gets her projects done on time, who always leads projects, an executive. What is going on? And she, which she's okay with me sharing, that she just recently found out that she is in perimenopause. And this is a big shock to her. And this is an identity issue for her. She immediately started struggling with identity crisis, right? But at the
Hmm.
same time, this is something she's been dealing with for a year, and she thought she was losing her mind because she just could not understand what she was going through. So I think those around us, just speak up to people around your age who are slightly older than you, who are women, who can maybe guide you, and then talk to your providers and talk to the right provider, right? You don't want to go to an urgent care and talk about it, because they may not be able to follow you through your journey of care, right? Make sure you have an assigned provider you're consistently seeing who can help you figure out things on a consistent basis.
Yeah, so how do we talk with both our loved ones and our provider, with this open door of saying, hey, without feeling, I guess, stigma or feeling bad about this? I guess would probably be around empowerment of your self, right? Your whole self, and being able to learn how to be comfortable with the words that we're using. But how do we do that better? How do we come to the table with addressing this with our loved ones?
Positivity. Have you ever seen a 200-pound woman make you feel like being 200 pounds is the best thing on earth? You have
Hmm.
to make them see that being going through menopause is a privilege. It's an opportunity that we're alive to go through this, right? We're alive and they get to join us in that journey. They get to learn from that experience. So when they get to our age, or when they see somebody else experiencing it, they can have empathy and sympathy and support them, right? So if we address it from a positive perspective, hey, I have night sweats. So I'm gonna need to turn the AC down. But guess what? You get to have an extra blanket, right? You can make a joke out of it, right? As
Yeah.
opposed to feeling horrible and reducing our self-worth, we get to make them almost feel jealous that they're not experiencing it. And that's when we have to know that we need to empower our own languages, use languages that are very empowering. Like, hey, that means I'm getting older and wiser, right? I'm a wise woman. I'm going through menopause. I get to experience this. I get to tell you what it feels like. So if you get married, if it's a man, you get married, you can tell that to your spouse. If you're in a hetero relationship, if you're not in a hetero relationship, whatever type of relationship you are, you can both experience that together. So educating people so they themselves can know about that. And with if we have little children, we just have to explain to them, mommy's going through some changes. So if mommy talks to you in ways that are not her typical normal self, just let mommy know it's not okay, that she made you feel bad so mommy can correct. But make sure you always speak up because mommy loves you and mommy wants to hear and understand. Right. And it's a good thing mommy's going through this because it's going to make her be stronger and better and really know herself more. So it's really about using positive words and language to bring them along, especially if you're in a relationship with someone of the opposite sex, right? Um,
Mhm.
you really have to help them understand because they don't understand how you're okay at 3 p.m. and by 4:30 you're ready to just scream the hell out, and by 4:45 you have no idea that even happened because you've moved on while they're still
Right.
tiptoeing around you, right? So really helping them understand what it feels like.
Yeah, and then with your doctor, I've had both success and setbacks with both PCP, and then going to a specialist, but I didn't realize that the specialist or the OBGYN is really, or, I some of the help that I have with my HRT is with my compound pharmacist who is able to discuss and talk things through things. So, what is one of the broad words or conversations that you should have with the doctors?
Hmm. Let me take a moment.
Mhm.
Get a doctor. First of all, I would recommend if you have to pay privately, if you can afford it for your annual, try to do that with your primary care doctor or with your OBGYN gynecologist. Try to always have an annual exam. And I always say for females, we should be going to our gynecologist for our annual exam, not our primary care doctors. That's what I highly recommend because of how
Mhm.
they will talk to you is different from your primary care doctor. And the reason I always say get your annual is that's when the doctors give you the most attention. In healthcare, we always talk about going to your doctors. Doctors also have time limitation, right? So to get what you need, you may have to go multiple times, and sometimes there's no appointments for 3, 4 months or a couple of weeks. So if you go for your annual, the doctors are able to ask you, sit down with you, and really give you the attention you need. Otherwise, I would highly recommend if you can break out your appointment into two, so you can really get the doctor's attention, not the 5, 10 minutes, but at least get 20 minutes. That would be the best. But first of all, ask them questions, right? Hey, I'm 39. What should I be expecting at this age in terms of my women's health, right? I remember when I was 34, my gynecologist came to me and said, "Hey, have you thought about egg freezing?" I'm like, "Why would I freeze my eggs?" And she was like, "No, really, have you thought about it?" I'm like, "No." She's like, "Well, let's talk." And I'm like, "Okay." She's like, "Based on what I know about you, you're not about to have kids, and I recommend you look at this option because of these reasons." And I'm like, okay. And about 6 months later, she called back and asked if I had taken those measures. And I said no. And about a year later, I went back for my annual and she asked the same question. This prompted me to really look into it and to say, okay, this is a really good option for me, right? Because I stayed with the same doctor through the journey and she was caring and took her time to really follow up. So I will say, talking to your doctor, ask age specific questions, right? I'm 52. I'm about to go into menopause. Some people go into menopause late. What should I expect? I haven't even experienced hot flashes or night sweats. I have some
Mm-hmm.
friends who are
Mm-hmm.
going through that. What should I expect? So when you give them age specific, it helps. And when you also are able to say, I have an aunt or my mom or grandma went into menopause at this age, it really gives them the perspective for them to speak to you and really guide you, or even give you directions to go do more research to bring back to the next appointment. So, age specific questions. And if you have any history of breast cancer, of any type of hormonal issues, thyroid, for example, bring that into that conversation too.
Yeah, those are great. Those are great. So, if we were to walk away with three things from our podcast today, what would you want our listeners to know?
When you're thinking about your menopause, think about your mental health. When you feel like you're having racing thoughts, write it down or track it and make sure you ask your provider about that. When you're thinking about your menopause, think about your mental health and make sure you track it down. And when you're thinking about your social health, think about how your menopause affects your social life, your relationships, your mental health, and your physical health. So always think about your menopause journey from a mental health, physical health, and social health perspective.
Those are wonderful words, Dr. Komolafe. We thank you so much for being here. It's a
Thank
wonderful conversation.
Thank you so much. I appreciate you for
You,
having me.
yes. Well, please listen in as we release new episodes of Menopause the Positive Way the first Wednesday of every month. And until then, here's to your continued health. We are so glad you joined us for this episode of Menopause the Positive Way and hope you will share this podcast with friends and family. You can subscribe to the series wherever you get your podcasts. Along with this podcast, Positive Health also offers a holistic, one-stop digital health experience supporting your body, mind, and spirit during the menopause journey. If you or anyone you know is looking for guidance, education, and services that address the many symptoms and needs experienced during your menopause journey, you can become a member of our pilot program. And you can join by visiting our positivehealth.com website. That's PAUSITIVE health.com, making life easier and helping you make a change for the better.
This is an educational podcast where the views of our guests do not necessarily reflect the views of Positive Health. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Positive Health does not provide medical advice.